Good evening. My name is Joe Marino. I am a resident of Guilford, Connecticut, and a permit holder for 20-some odd years. I've listened to everyone here, and I kind of agree with them. I know they vented out to you, and I'm glad you took it. Just don't admonish them for it. They just told you what they believe. I have a lot of that questions, but same questions that people have been asking here, so I want to get to my peak question. That's mental illness. I know everybody's been throwing that around. I'm tired of hearing it, mental illness, but I really don't believe any of you know anything about mental illness. And what it takes to, say for example, I'm sure a lot of people here have seen people who react differently to something. So you may believe that, oh, there's something wrong with this guy. What do I do? Who do I contact? Who do I see? And if I do, am I infringing on his rights? This is the main thing, a mental issue, one of them. Now, I have a friend who's a medical psychiatrist, a doctor. He's been working for the state of Connecticut for 20, 25 years. And I can't reveal his name. If you like his name, then I'll talk to him and he'll talk to you. I consider him a very, very bright individual. He works for the state, like I said, and he takes care of children with medical problems. I mean deep medical problems. We're talking anywhere between 5 to 14 years old. A very critical period in the age bracket that needs to be addressed. So one day, someone at the institution that he works for said to him, well, we know you're a good psychiatrist, so can you help this one child? And she was in deep trouble. So they told him, on no uncertain terms, that you will administer drugs to this person. And he refused. After he'd seen her, talked to her for a couple days, said this child needs more help than drugs. She needs complete therapy for a couple of years, one-on-one. This one-on-one business, I don't know if everybody knows, but back before, I think 1970, 80 or so, late 80s, when you have a medical problem, you see a psychiatrist and they put you on the couch and they talk to you. Yeah, it takes time to do this, right? Period of time, sometimes 6 months, a year, 2 years, who knows what. But you realize how much money that costs. Millions of dollars, millions of dollars. And this is what you say when you say mental health. Can the state afford these millions and millions of dollars? And where are you going to get this money from? From the government? From the state? Who? Where's it coming from? And I want to tell you that if you investigate, you said you got a year-long study in mental health. Well, let me tell you something that's going to take that year plus. Because we need to understand what mental health is all about. I feel sorry for these kids who take these drugs. I've seen them. They seem like they're spaced out. And once they're off these drugs for some unknown reason, or someone does not administer these drugs correctly, what happens? And that's my problem. This is mental illness to the ultimate degree. 90% of our shootings in this country have been done by people who are nuts. And what have we done? Nothing. National Institute of Mental Health has done nothing for these people. The state of Connecticut has done nothing. If you're a nutso, drugs, or that's it. Out the door. And that's my problem.
I agree. My daughter is a nurse, and recently she had a cycle on the mental health part of it. And no, you're right. There isn't enough that we do. And it is our hope that, and I can't guarantee, but I will tell you a lot of us, including Dave and I, are following this committee. There's actually 2 committees. There's the governor's committee, and then there's our own that's supposed to report back on February 14th. So I hope we do something, because this is a very serious problem. And where the money's going to come from, part of the issue was trying to figure out how we can develop a program that gets some money from the federal government, so we're not footing the whole bill. That was part of all the mechanics of it. Chris Diorio is in the back there, and I'd ask you if you could just give him your phone number, because what I'd like to do is maybe, as this progresses, send it to someone who apparently you trust and know and works for the state. You can do it without telling me.
Good, that's
Or
great.
disclose him.
He's afraid to speak up. He tried to speak up many, many times in the state. And you know what they said to him? Either you follow our rules or out the door.
Yeah, and trust me, I believe that. But I would certainly send him stuff. I'd like to get his comments, because
Okay,
we're
good.
following this very carefully.
I'll do that.
And I thank you for your